to emotionally switch off from the high pressure role which you play inside an operation theater, and then you move into being the photographer or the avid travel lover that you are?
Yeah, partly by training and partly by intention, because
Hello, everybody. Welcome to another episode of Searching Soulmate Conversation, where we bring to you another guest who will be sharing with us his story of finding purpose, passion, and balance in his life. With me today is Dr. Tanmoy Das, an eminent doctor, an anesthesiologist whose life is about medicine and soulfulness. If not inside the operation theater, he is primarily behind the lenses. He's an avid photographer. His love for photography has taken him to many places, clicking the wild. And today we will hear just not about his passion, but also about his profession, which is much not spoken about. We really do not know what exactly happens inside the operation theater, and what kind of challenge, stress, burnout doctor goes through in his life. Dr. Das also runs his own YouTube channel. Do follow the same, The Healthy Drive, where he speaks about the importance of nutrition and the organ health. And he also kind of through his love for photography, he is also actively involved in spreading awareness about climate, environment, and the urban structures between which we stay and society at large. Let's dive into his journey. Let's hear from him about medicine, mindfulness, and his love for photography and travel. Welcome, Dr. Das, and I'm really looking forward to having this conversation with you.
my pleasure too. It's an honor to be here. I'd be happy to share my experiences with you.
You know, sir, when I met you for the first time, it was in a social gathering. And that first time, I remember something which we spoke about was the actual hobbies which you pursue, photography, your love for driving, and you just slowly also dropped the fact that you are a doctor. Nobody in that gathering actually introduced me to you very well as to what you actually do for your profession. And when I spoke to you later on to understand a little bit about you, I was quite, astounded for the fact that you are into an extremely high stake job. You have to be inside operation theaters regularly, and your presence decides the life and death of patients, the success of operations. And just not that, you are also kind of always on the go to help people have a very smooth experience inside the operation theater, also people who are also there. Saying so, how do you manage all this stress? One, and second is how does a good day look to you?
Well, anesthesiology is a high stakes branch, because you must have heard that there is major surgery and minor surgery, but there is no minor anesthesia, because the very first medicine that we use to anesthetize a patient can actually kill the patient if I miscalculate the dose. So yes, it is a highly stressed profession, but then we are trained for it. We are trained for years to be able to anesthetize patients. Just like a surgeon is trained, we are also trained, and that is how we manage. Our role is such that anesthesia makes it possible and safe, safety being the key factor. So we focus on that. and we are there. Anesthesiologists are also known as guardian angels of the operating room. Whenever there is a crisis, whenever there is a problem with the patient, we manage all the vital organs while making it safe for the surgeon to operate. So, but this highly stressed profession has does have its impact on our daily lives, because we get stressed out so much. In the long run, it can lead to something known as a burnout.
Yeah.
So that is what we are always looking out for, and that does need a lot of attention.
Okay. Sir, how does a good day at work look to you like?
Yeah, a good day operation theater can actually be compared with a busy airport. Like a busy airport has, all of you must have seen an airport. An airport has say 2 or 3 airstrips, um, hundreds of flights to be taken off on that day, and thousands of passengers.
Yeah.
Similarly, we have in my hospital, there are 15 operating rooms. There are nearly 100 patients to be operated, and we have to make them possible in these 15 operating rooms. And that the bigger management is like that. On an individual level, I will have 6 to 8 operations or surgeries on my list, of which I know beforehand each and every patient. We do something known as a pre-anesthetic checkup, but individually I will meet every patient, and I have just a couple of minutes to take the patients into confidence, because every patient comes to the operating room, whoever he or she might be, is very anxious, is very scared. So my job in those few minutes is to make them comfortable, is to win their confidence and assure them that everything is going to be fine. You will be safe throughout the surgery, and you will not have pain afterwards, because people are scared of pain, because people are scared of falling unconscious. So all these fears are to be allayed, and that is what we do. And at the end of the day, we make sure that the surgery goes well. That is a good day. A bad day, a lot of add-on cases, emergencies come in all the time.
Yeah.
There may be an accident, lot of trauma cases can come. Suddenly, one of yesterday's patient might have to be re-explored.
Yeah.
So these things can make the operating list go haywire, but we manage somehow. And but the stress gets added on, yes. But we are there all the time, all the time, all the way for the patients.
Um, I think listening to you, just I can imagine, and the way you drew the analogy between a busy airport where like there are hundreds of flights, thousands of passengers, and that pilot is responsible for the safety of those passengers. The entire authorities are responsible, on ground people, staff is responsible. It that analogy made me actually think that it's so easy to say that this is not really going well, this didn't happen the way, but the amount of pressure you have to take in your profession is uncomparable to any. So I think an amazing insight you gave to a busy doctor's life inside the operation theater, much we don't get to hear. And you, as you mentioned, it's a very high stake job, and your profession, your hobbies have kept you I guess more sane in this entire process, right?
That's right. That's right. Because I actually, because of many circumstances, I came very late into my hobbies.
Okay.
But today I admit that that was a mistake. It took me a long time. I was so busy with my career. We all become so busy with our careers and professions as doctors and highly stressed profession, that we are only into that. We forget that there is any other life.
While listening to you, like I'm sure all like me, all our listeners would also understand the stress you feel on a daily basis. Tell me something, as as we are the outsiders, we just understand what happens to our patients, people who are admitted or going for checkups and all that. So as a doctor, what is it that you feel we do not understand, being on the other side?
Yes, actually, because we anesthesiologists, we do not come to the forefront. Usually the patient goes to the surgeon and the surgeon operates and the patient goes home. So in the olden days, the patients would never meet the anesthesiologist. But today things are different. We are the people who call ourselves the perioperative physicians. And we would like to tell you that anesthesiology is the science that makes surgery safe, feasible, and possible. I wish more people knew this. So, what we do is we see the patient beforehand in the OPD, we call it the pre anesthetic checkup. We optimize the patient, like each patient must be having so many comorbidities: high blood pressure, high blood sugar, heart problems, thyroid problems. So all these things are optimized, means we give medications to bring them to normal, and then only we allow them to be admitted for the operating room. Inside the operating room also, we make it possible for the surgeon to just focus on the surgery. The patient's lungs, heart, brain, kidneys, everything we take care of. Once the operation is over, we make sure that the everything is fine and the patient wakes up without pain. So this is the behind the scene part that we take care of. Even after the post operative period, we make sure that the patient is doing well 48 hours, 72 hours after surgery. So this is the thing which most people don't know about, and this is the perioperative physician role that we play. And these that is why the anesthesiologists are called as guardian angels of the operating room. And today, another thing which people should know is that modern day anesthesia is very safe. If the death due to anesthesia itself is 5 in a million,
Okay.
5 in a million by industry standards. There is something known as Six Sigma. Six Sigma was developed by Motorola, where if they manufactured a million phones, they would have 7 defects. So we, as anesthesia deaths, is perhaps the only health data which comes closest to that.
Okay.
There, in America, 80,000 deaths occur due to medical errors itself.
Okay.
Compare it to anesthesia deaths, which is just 5 in a million.
Okay.
So it is a very safe branch. Modern day anesthesia is. This is another thing which people do not know.
Right. Dr. Das, your love for photography, as you have mentioned to me while discussing that it started very young, but you learned it way later on. So, what led you to that? And that first time you took that decision of reinventing yourself through your lost passion. Can you share some memories from that phase of your life?
Yeah, actually, it happened very late in my life because I used to love photography as a child. When I was in school, my father had given me a camera. I used to love clicking with that. But all that had to take a back seat when I pursued my medical college career, and later on when I pursued my career as an anesthesiologist. So as late as when in 2009, when I was 48 years old, I was getting kind of burnt out. Burnout is a very bad thing to happen to a doctor. It is a feeling when you get up in the morning and you don't feel like working anymore. So that is to be prevented, and the only way to prevent it is to develop a hobby which is creative and which takes you away from your profession for some time and lets you engage totally in some other thing. So I kind of loved photography. I knew that. So I attended a conference in photography in Bengaluru, which was organized by wildlife photographers. So from there I booked a trip, which I attended the very next week, and there it was completely different experience from me. And as I went there with some learned photographers, I picked up being there, how to handle the camera, how to handle my lenses, and the feeling of being in the jungle was so relaxing and so thrilling also, because I could spot a tiger in my very first expedition. So all these things completely took me away from my work, and this is what science says that is very relaxing and very essential, that whenever you're doing a high stressed work, you must have a creative hobby which will take you away from that. And it was a wonderful experience for me, and I started from there rekindling my passion for photography. I am passionate about whatever I do, whether it is anesthesia or it is photography. So I rekindled my passion. I learned from from very experts, and then I started learning on my own. So that was my first trip, and later on I went for many other trips.
Dr. Das, as you mentioned that a part of your childhood was growing up in Rourkela, and so can you share a little bit of that? And during that time, what stayed with you? What memories that you kind of use even today while taking those pictures?
Rourkela was a very small town in Odisha that time. When I was growing up, there were a lot of gardens. Every house has a garden. My dad used to do gardening, so we were very close to nature. And there were a lot of wide roads, trees, open fields, and all these things are there in my memory. I used to go to school in a bicycle, 5 or 7 kilometers one way, and then come back again. So once in a while we would stop, look at the trees, look at nature. So all these things, the nature, a man is the happiest when he is closest to nature. That is a known fact.
Right.
So all these things have remained with me, and whenever I feel I can go back to nature, and that makes me the happiest.
Absolutely.
So, and then it has influenced my photography also.
Absolutely. In fact, I would love to share a small incident which I also embarked on some time back. I had never done a night safari. So I did a night safari the last time I was at the Kanha National Park. Something which was extremely thrilling, to say the least, because of course it was not inside the core area because you are not permitted in the night. But saying so, that thrill of trying to, like, firstly you are seated in a open hood car. There is so much of breeze and fresh air, and then that that vastness which greeted us, like the sky, the darkness, when at times we were just waiting in a small in certain areas to hear if there was something around us. I think it was one of the best experiences of my life. And for a minute, that those moments when the light was being switched off for us to kind of immerse ourselves into the experience, it was thrilling to the power of infinity, I would say. And also something which I felt was, it made you realize, you were just a speck in this entire universe, and that is quite humbling, to say the least.
Let me tell you something interesting. The Japanese have a concept known as forest healing. There's nothing, they keep some benches inside the jungle where people will come and just sit and go away. And that being in the jungle, forest itself can heal people. That is also validated scientifically. So that is why we feel so good when we go to the jungle.
Right. How do you emotionally switch off from the high pressure role which you play inside an operation theatre, and then you move into being the photographer or the avid travel lover that you are?
Yeah, partly by training and partly by intention, because what helps most is being away, being in the jungle, being in the forest. When you take yourself away from a very stressful situation and be with nature, that helps to completely switch off from there and get into the role of what you love to do equally well and with equal passion. If you follow my photographic journey, if I follow my photographic journey, initially I used to do a lot of tigers, mammals, but later on I developed a love for birds, because birds are so beautiful, and since birds can fly, it symbolizes freedom. So that is something which appealed to me, and what really appealed to me is that birds are very difficult to photograph. They are a challenge.
Right.
Anesthesiology is a challenge for me. That is why it attracted me. And in my hobby also, I chose something similar, equally challenging as anesthesia. So one of the most difficult wildlife photography to do is to capture a bird in flight.
Right.
And that is what I kind of gravitated towards. and you will see if I give you
Yeah.
some pictures
Yeah.
which I can share. Birds in flight is what I specialize in. I really enjoy doing, and it is a challenge which I am always respond to.
In fact, I have seen the pictures which were posted on your own social media handles, and a few which you've sent me. And honestly, I'm in love with them. Yes, do understand from few of my own photographer friends, the challenge of actually clicking birds, and more so in flight.
Yeah.
And so now we find the correlation, how you have branched out your love for what you do inside the OT to
Yes.
photography also.
Yeah, that is what one thing has led to the other,
Absolutely.
and both are equally challenging and equally thrilling for me.
Thrilling for me and
Yeah.
fulfilling also.
Yes, very much.
So you basically said that you do a lot of birds in flight photography. So where do you generally travel to, and how do you kind of make out time for those, or do you do solo trips? Can you share some bits and pieces information about the same?
Yeah, first of all, I would tell you how I make time. That is very important. I make time because I am fortunate enough to work in a group practice.
Okay.
So this group practice allows me to take time off for whatever reason I want to, whether it is a holiday or it is going for my passion or if it is an emergency, without affecting my practice much. So this took a long time to develop.
Okay.
It is only, that is one of the reasons maybe I started late, because circumstances were not, I felt, were not ideal. So ever since we have developed this group practice over here where I work, so that I'm fortunate, I'm grateful to my colleagues. We have an arrangement that we can take time off. So that is what has made it possible. And secondly, where do I go? Okay, now I have traveled to various parts of the country, but there is a place in Odisha near Chilka Lake, which is a village known as Mangala Jodi, where 8 to 10 lakh birds come every year. These are migratory birds from Siberian area, and it is a place which gets filled up, and all you can hear is bird sounds over there. So it's a wonderful bird paradise for all bird lovers and bird photographers. So I go there every year. Not only I click photographs, for the last 10 years I have been going there. And I also conduct workshops over there.
Right.
So if you love nature, if you love birds, it's a wonderful place.
Absolutely. I've been to Chilka, but this place you've
So this
said
place is in,
a little away.
yes.
Okay.
It's a Chilka used to be till Mangala Jodi.
Okay.
Mangala Jodi has a story. So as the waters receded over the last 60-70 years, what has formed is the marshy land. So this marshy land contains the right the combination of water, fresh water or rather brackish water, along with flora and fauna. Fauna means snakes, insects, all these things which attract birds.
Okay.
So that is why they come here in the winter journey. And and because this marshy land allows boats to go, so we travel in boats and get a very close view of the birds to photograph.
So, do you also need to kind of get inside the water at times?
Not really. Being inside the boats is good enough. Because we get an eye level with the birds, so that is. Once upon a time, the people of Mangala Jodi used to kill the birds for a living. There used to be two types of profession there. One is fishing, one is bird hunting. But later on, they were approached by the government and the NGOs, and they were taught that killing the birds is not just same as killing fishes. So they turned conservationists. Once upon a time, the person who was a bird poacher, they became conservationists, and they became the most wanted guides. So today that tradition continues, and people from all over the world, they come to photograph birds in Mangala Jodi.
Is
So
it
it's a
generally very
success story.
is it generally very crowded
It
during this
yes,
migratory
during the
season?
season it does get a bit crowded,
Okay.
but then yes, you get your chances,
Okay.
and it's a wonderful experience
Can
over
you
there.
can you name a few of the birds which you have captured?
There is a resident bird called whiskered tern, which is my favorite,
Mm.
and then there is northern pintail, there is reddish shelduck, and then there are raptors like peregrine falcon, the Brahmini kite, and there are many other birds. Which,
So
at least you will get more than 100 species over there. It's a wonderful place.
amazing. We had heard so much about migratory birds, and just listening to you is taking me to those old days. As a child, we used to go to Khidirpur, a zoological garden, because you used to find a lot of migratory birds over
Yes,
there
yes.
also. So like just listening to you, it's taking me back to those days when it was way more in abundance because of less
Yeah.
pollution and
Mm.
more green foliage, less noise, so birds used to come in. It's a wonderful it's wonderful to hear from you about nature, and just hearing itself is making me smile. Thank you so much for watching. Please follow, like, and subscribe to our channel, and thank you once more.